Hi everyone, my name is Michelle Wadsworth and I will be presenting a quality concern issue that was brought up at my work site, which is San Joaquin General Hospital. So the question that we propose is, what is the current issue that we can be improving on? The quality standard of bedside reporting is something that we could definitely be implementing more at my job site. Bedside reporting is not being done consistently at San Joaquin General Hospital. What is the current issue? Like I explained, it's bedside reporting. Failed hands-offs report are a common problem in the healthcare field. As stated by the Joint Commission's website, failed handoffs are a long-standing common problem in healthcare. In 2006, the Joint Commission established a national patient safety goal that addressed handoff communication. In 2010, the requirement became a standard. Also, bedside reporting is of concern because ineffective communication is the most common sentinel event that occurs. According to the Nursing Management's Journal of Excellence in Nursing Leadership, ineffective communication is the most frequently reported cause of sentinel events in the United States. Also, bedside reports have positive repercussions. Bedside shift reports are viewed as an opportunity to reduce errors and they are important to ensure communication between nurses, not amongst themselves, but with communication with other coworkers, doctors, patients, and family members. Models of bedside report incorporating the patient into the triad have been shown to increase patient engagement and enhance caregiver support and education. Why is bedside reporting important? There are various reasons. One very important one is direct visualization of the patient. Direct visualization of the patient allows for the oncoming nurse to confirm the information being relayed amongst themselves, and it also allows for affirmation of on-the-spot information. For example, doing bedside reporting, you can immediately identify the patient by asking their first and last name and date of birth. You can also look at fluids that are running, the rate, make sure it's the correct medication. You can also analyze and do a quick assessment of wounds, making sure it's on the correct side. There's been many mistakes where left has been confused from right or right from left, and so forth. Doing bedside reporting also reduces those errors, because you have that visualization in front of you. Bedside reporting is also important because it enhances nurses' surveillance. So it provides for greater safety precautions, such as ensuring that the side rails are up, assessing for fall risk patients, making sure that they have their fall risk socks or armbands and so forth is on and adequate. Bedside reporting is also important because it has a dynamic of patient involvement, which increases patient satisfaction. It also helps the patient clarify any information or ask any questions that they're uncertain of. Patient involvement increases patient satisfaction, which in turn ensures that the hospital gets paid through the HCAP survey that is paid for by Medicare and Medicaid. Bedside reporting is also important because it meets JCAHO standards of bedside reporting. And this is actually a standard our hospital has lost points on when JCAHO came to inspect our hospital. This is a quality improvement that we together as a team could work on. It ensures continuity of care by providing a smooth informational transition from caretaker to caretaker, and it promotes staff accountability by making sure that all required tasks are completed in a timely manner. I can't recall a time I was getting a report from a nurse and we were looking through actually the MAR, and she didn't realize that there was an order on there for an insulin drip, which is a pretty high alert medication. So we had to immediately address that and see if the doctor wanted to continue to implement that or go with a sliding scale. Current status. What are the strengths of doing bedside report consistently on all three of our sister floors, 3B, towers, and medical guarded unit? The strengths are the willingness and the support of the new leadership that we have on this new process. We have new management at San Joaquin General Hospital for our three sister units. She's very open with recommendations or ideas, anything that would improve quality patient care as well as safety. We also have highly trained, competent staff, especially with our new computer program that we have implemented at our hospital. We are up to date with the latest updates with our computer anything technology that we've actually implemented on our floor. The strengths that we also have is we have good communication skills at San Joaquin General Hospital. I think that's an important trait that a lot of nurses have, is the ability to communicate well with others and to relay pertinent and important information. Is the project currently ahead of schedule or on track or delay? The initial weakness with this project was that when we first began, there was resistance to change. A lot of people don't like to change something that they consistently do out of habit. But if you give them good reason and you educate and you show points, then people are more likely to pick it up as a new habit or implement such change. There are lots of potential disruptions, as we know, being a nurse, that can range in a broad spectrum, anywhere from patient requests, patient needing something in the middle of bedside report, or giving during shift change, requesting food, or needing any kind of changing or anything of that nature, as well as family requests. Families can be helpful as in terms of asking questions and giving and getting information, but they can also interrupt and they can prolong the process of bedside reporting. Excuse me. There's also limited charts at our facility. We have what's called the WOWs, which is the computers on wheels, where we can see the chart and all the information that pertains to the patient there. Those are limited, and sometimes it's hard to get one where you can look at for yourself the information. Also, just other possible disruptions would be tasks due during shift change. Sometimes some medications fall during that time period where we have to change shifts, which makes it a little bit difficult because it delays the time period that we have set aside for each nurse and for each patient for adequate and quick, efficient shift change. There's also the disruption of unnecessary information. Some nurses like to prolong shift change report by adding information that's really not pertinent to the patient's plan of care. So it's important to stick to what is pertinent to the patient and his healing process, and it is part of his care plan. Issues and resolutions. Threats to bedside reporting. There are some potential threats that I can foresee is, for example, the policy and restrictions on the medical guardian unit. There is one unit where where we take care of prisoners, which we wouldn't be allowed to do bedside reporting because of our policy, just for safety hazards for the patient and as well as for our staff members. Also, HIPAA violations can occur in other parts, not just in any part of the floor. Specifically, I can think of our floor called towers, where we have 4 patients into one room. Sometimes you don't want, other people in the other room listening to your medical habits, or maybe you have family members that are in the room when bedside report is happening. And in that case, the nurses have to ask for permission to be able to do bedside nurse, to be able to disclose such information. Anticipated impact of the bedside reporting project is numerous, but the big points that I seem to take home here is time. A quick bedside report saves you a lot of time because the information is there, whether from the previous nurse or from the patient, or having your chart right next to the bedside as well. Cost, you're saving a lot of yourself, the hospital, lots of money from making potential errors that can happen, and accuracy is key. Timeline of an example of an efficient report would be the AIDET model. It's an acronym for a consistent, systematic approach to communication among healthcare professionals that can be used to provide a structured bedside report between nurses at shift change. The step 1 is to acknowledge, greet the patient and any other family member or healthcare team members who are participating in your patient handoff at bedside. Step 2 would be to introduce yourself and the oncoming nurse to the patient. Allow the patient and or the designee an opportunity to introduce themselves as well. And step 3 would be duration. Provide an accurate estimate for the time your handoff report will take place, and let the patient and or designee know how long you'll be caring for that patient at that day. For example, I'm a night shift nurse. I would come on and say, my name is Michelle and I will be here during the night for 12 hours until the next morning. If any visitors at the bedside need to step away during the report, give them an estimated time and they'll need to wait before they can return back to bedside. Step number 4 is explanation. Explain to the patient and or designee that you'll be doing in the immediate future and over the course of your shift in a clear step-by-step fashion. Answer the questions and make sure you know how they can contact you when needed before you leave the patient's room. Step 5, which is a very important step, is to thank them. Say thank you. Thank the patient and or designee for their time and participation in your bedside report, and validate any information or concerns that they've disclosed. When visitors return to bedside, also thank them for their cooperation with this important process in the patient's care. More specifically, we like to thank them when they come. Thank you for coming to San Joaquin General Hospital. Ensuring bedside reporting is what our ultimate goal is. Right now we had kind of sporadic compliance, but with more education and holding each other accountable, we can reach the 100% goal. Thank you for watching my video. I would like for you to contemplate what is your report routine and what you can do to improvise. And also, will you be a part of the change and helping hand off change from bench to bedside? See you at bedside. Here are my references, and thank you for listening.